Good afternoon. Thank you, Governor, for allowing us to share our stories with everyone today. I'm Dr. Sandra Kemmerly. I'm the System Medical Director for Hospital Quality for Ochsner Health, and I am an infectious disease specialist and have been co-leading the Ochsner Health response for the last 18 months. We actually started in January before we had our first case in March. And the Governor is right. I mean, we certainly need this mask mandate to slow the spread of this rapidly spreading Delta variant. I mean, you've heard it before, this virus, this variant is different than what we've seen of the other surges, and it's a formidable opponent. In some ways, we're in a worse situation than we have been in the entire time. We were very encouraged by the vaccines that were on the horizon. I was thrilled in December when I was able to get my vaccine, knowing that the vaccines would get us out of this predicament and end this pandemic. However, despite the governor's best efforts, all the efforts of everyone, people have chosen not to be vaccinated, and consequently, we are suffering under these circumstances. And this Delta variant is far more contagious and more severe. It's causing more hospitalizations than we've seen in the past. But don't be confused. The vaccines work. They may not be perfect, but they work. 90% of the people in our hospitals at Ochsner around the state are not vaccinated. Again, 90% have preventable illness that they don't need to be hospitalized for. And we also know that if you're fully vaccinated, that the vaccine prevents over 99% of deaths in fully vaccinated people. It prevents death. It may not prevent you getting it. It may not predict a breakthrough infections, but it does decrease hospitalization and it does prevent deaths. Again, not 100%, but greater than 99 is pretty good, and I think we have to be mindful of that number. So here we are urging everyone 12 and over to get vaccinated. We're including pregnant women, lactating women, women thinking about getting pregnant, and just please, everyone needs to get vaccinated. This situation is preventable, and again, people don't need to die of COVID-19 in 2021. And it's not too late to get vaccinated. Keep in mind, when you're fully vaccinated, 2 shots for Pfizer and Moderna, you need an additional 2 weeks. So if everybody got vaccinated today, it would be 5 to 6 weeks before they fully vaccinated and are protective. So we've got a long few weeks ahead of us, even if everyone was to get vaccinated today. So I'd urge you to get vaccinated and don't wait. And it's okay, as Dr. Cantor said, to change your mind. That's perfectly acceptable. I can tell you, again, that this COVID variant has changed how we see patients, and certainly the vaccines misinformation is out there and is incredibly difficult to dispel. So I'd urge everyone who's still thinking about vaccines, talk to a trusted physician, a friend, people that have gotten vaccinated, because we need everyone to get vaccinated. And as everyone mentioned, our hospitals are full, our staffs are tired. We have beds, but we don't have doctors and nurses and people to care for these patients. And again, the other patients, the strokes, heart attacks, people are waiting at home and they're not being cared for. So I'd urge everyone to get vaccinated, and please call us if you have any questions. Thank you, Governor.